Hey everyone. I just wanted to talk to you guys about my experience with the coronavirus and going out to go get tested. Um, I'm actually wearing a Bape shirt today. I didn't go to the shop to pick up some clothes to, just for the videos. And it's been a long journey, especially for this free testing. Let me see. I felt sick on the 20th of March. But for a while, I had like a minor sore throat in and out for like a week. So I started coughing on Friday. I think mainly because my type of work, I inhale dust while working. And on Friday, it was very heavy, even though I was wearing a mask. And then I was going in and out of that room so I could get some fresh air. When I'm outside, it's cold. When I'm inside, it's too hot and dusty. So it affected me more. After work, I felt worse symptoms. I felt headaches. I felt a sore throat actually coming on. And then I don't know if I ate something wrong, but I had diarrhea that day too. I didn't have flu, but I slept it off. I slept for like 16 hours that day. I felt more like I recovered by like Saturday or Sunday. I didn't have any of the aching. The sore throat was already going away. The diarrhea was in and out. So I felt like, okay, maybe I'm ready to go back, but to be sure, I wanted to take the test. I go on Monday. Maybe that was a little too late, but Monday was raining all day long. So even if I went to work, I would have got worse. I would have got super sick because it was raining all day. Even though I have a rain jacket at work, it's just not good to work inside and out in the rain. Currently, all essentials are open stores, and non-essentials are closed. So, for example, my store, I shouldn't be open at this moment. I only do like by appointment only, and I do buy stuff from people. I still do that because it helps me make some money on the side, because right now all money is being depleted. Very little work and all that. Most people are not working to try to combat the virus. So Monday, I went to Elmhurst Hospital to try to take the test. I was the 6th person online before they closed the line, and I was all soaked because I waited there for an hour. My shoes were super soaked, my pants. I did have an umbrella, but I still got soaked. I told the police officer there, the hospital police, if you can hand out some like a band, so that the next day we could come back and those who were already here can be seen first. They said no, just come back the next day. So all right, fine. This is the way you guys want to do it. They told me to come back at 9. I came back at 10:30 the next day. I still did not get seen, and this time, the next day, which was Tuesday, it was nice and warm. So by the time I was there at 10:30, I was the 230th person online, and they cap it off at 200 people per day. I don't know if that's a good thing or a bad thing, but that means that the data will be slow too, because that means you're only giving out 200 tests a day. And if they come back mostly positive, it looks bad. But also maybe because they want to see if they can extend the amount of materials they have for the testing. So I waited there for 6 hours. If I wasn't sick already, or I was already recovering, I most likely got even worse, because now I'm with potentially 6 people getting sick with them. Even though I have a mask, I still could get worse. My symptoms could get worse because I'm being around people that are also sick. I came back that day. I couldn't do anything. I waited 6 hours. My body was aching. I didn't bring a chair. Um, so I was extremely tired already. So that means in total now already, that's 7 hours I waited. I come back the next day on Wednesday at 7 in the morning, and there was already a line of at least 100 plus people, I believe. I waited this on Wednesday for 4 hours, from 7 to 11 to be seen, and I did finally get seen. The test is painful. They're gonna put a cotton swab in both your nostrils, and I think from there I lost my sense of smell. I literally can't smell much now still, and today's Friday. It feels like someone has punched you in the face. It gives you kind of like this tingling sensation in your nose. I can still feel it today. I can still remember how it feels today. So it's not a good feeling. I'm still waiting for them to see if they call me or not. If they don't call me within 5 days, that means I don't have the coronavirus. I might just have a flu, and that's good. If I do get called, I can't go back to work. I have to self-quarantine for 2 weeks. So there's pros and cons. So let's hope for the best. I am in my mid-30s, so the statistics show that most people in their 30s do not pass away. I don't have any previous health conditions, so that's another plus sign. So in total, I waited 11 hours to get seen for the free test. Why I keep emphasizing free tests is because you can also go for urgent care and take their test. They weren't very clear when you read the articles online if you only pay the urgent care price, or you have to pay additional $135 to take the corona test, because those are limited in urgent care locations. In a hospital, they have the most abundance amount. So that's the reason why I chose to go to the hospital. I did also call urgent care to see if I could make an appointment and go. They said it's only to the discretion of the doctor if they want to use the coronavirus, or if they believe that you just have flu-like symptoms, that's all you're going to get. You're going to get a test for flu and not the coronavirus. So that's why I still wanted to go to the Elmhurst hospital. Also, I tried for the walk-in. The walk-in is, the drive-through. And the drive-through is only by appointment only. And today is Friday, so literally I called on Monday. I still haven't got a call back since Monday. I think I did get a call from a random number, but they didn't leave a voicemail. I texted them back. They didn't respond to me for anything. So maybe that might have been the one, but I'm not 100% sure. That's the reason why I went to Elmhurst Hospital, even though it has very bad signs right now, because I just read an article where there was 13 people that died from the coronavirus within the last 24 hours. So I don't know. Is it good for you to go? If you feel like you have those symptoms and you really want to get tested and to to protect your family, I think you still should definitely attempt. But that's all up to you, because remember, when you go into the hospital, it's literally going into the war zone with all the sick people there. Do I regret going? A little bit, but if I need it to go back to work, I guess I have to do it, and I'm just waiting for the test results. And I did also go through a few interviews with some of the New York Times, just explaining the experience, because that I believe that this was too slow, to see a nurse to take the test. Where the America's the biggest coronavirus location tested positive, mainly because I believe we're too slow to interact with what's going on. So it's affecting people quicker and faster, because we didn't do the quarantine, we didn't close down our stores quick enough, and when we do the quarantine, people have to be at their home for 2 weeks. How do you expect them to go and get food? Do you think they have food for 2 weeks? I don't know. I don't think so. From what I've heard, if somebody tested positive in an Asian country, what they do is they actually bring food for you. They do not want you to leave the home because they want you to get better first before leaving. If somebody needs to go out to get necessities and they don't have much family member, or their family member don't know how to drive, and the infested one, the sick one, is actually the only one, the main primary caretaker, and they go outside, they're going to get people sick. So that's not going to be good for us. That's going to spread the germ even more. So what we're doing here might be not the best option, but we're trying. That's the best part. I am also myself making custom Supreme mask to help with the pandemic. I am trying to get the blue mask that they use usually at the hospital. I'm waiting for them to come, but because of this whole disease, everything's slow. The shipment is super slow. I ordered 2 weeks ago. I'm still waiting for it now, and it just literally updated tracking. So I'm very worried, because that means that the people that need it won't be able to get it soon enough. Thank you.